Okay, welcome back. Sorry, I got sidetracked there. Welcome to today's webinar. My name is Dr. David Kunashko. I am the medical director here at BioFlex Laser Therapy based out of Toronto, Ontario, Canada. So today's webinar is geared towards healthcare professionals that have BioFlex laser therapy or use laser therapy in their practice. Of course, anyone can listen in. It's not like I'm monitoring that. So if you have a personal BioFlex therapy system or any interest in this field, by all means, listen in. The webinar is recorded, and once we edit it, it will be uploaded to our website for access for free viewing when it's posted up, usually within a week or so as well. If you have any questions during the webinar, then type them into the Q&A box, please. And while we're at it, in the chat box, let me know where you're from. You can say your first name or what have you, geographically, if you use BioFlex, or maybe you don't use BioFlex, whatever the case might be. I just like to kind of know who's listening in. Okay, so let's get started. So I'm going to, usually when I do these webinars for professional systems, I review the anatomy and the etiology, pathophysiology, and signs and symptoms. Then I'll get into standardized treatment usually used for the condition I'm talking about, any advances or current research, so everyone's kind of aware of that. And then specifically why we would use laser therapy or photobiomodulation therapy, and a bit of research that's relevant. And then basically some tips and understanding of how to use BioFlex for the condition. Obviously, today we're talking about injuries to muscles or muscle strains. We're all aware of the basic anatomical structure of muscles and the surrounding perimysium and epimysium, endomysium, and skeletal muscle fibers. What you may or may not know is that a skeletal muscle fiber cell can have up to 4,000 mitochondria per cell, which means that it's highly energetic and very responsive to absorption of light for stimulation of healing. So when you add laser therapy to an injury like this, you will see accelerated healing, guaranteed, if you know what you're doing. So muscle fibers have these interesting cells. They're called satellite cells. They're not stem cells. They're kind of like a precursor cell to a skeletal muscle fiber. And there you can see the little blue blobs. They're surrounding and attaching to muscle fiber cells. And they're they're activated once there's an injury process that goes on. So these are critical in getting healing of skeletal muscle fibers, and I'll talk about these as we progress. So basically, when you have a muscle strain or a patient has a muscle strain, there's an initial regeneration process that occurs. Unfortunately, it's usually inefficient. And it's oftentimes hindered by excessive scar tissue formation, which means that the healing of the muscle fibers, once patients healed, tend to have scar tissue in their adhesions that make them more prone to re-injury. And that's what you want to try to reduce when you're healing with laser therapy and other therapies that you're going to do. So this is really critical in making sure that your patient does not come back to you with the same injury a few months later. So after injury, a muscle undergoes a distinct set of healing phases. There's a degeneration and inflammatory phase. This occurs almost immediately and then continues even up to 1 to 2 weeks post-injury. Then there's a regenerative phase that starts to kick in, usually within a week of the injury. It kind of peaks at about 2 weeks and then decreases 3 to 4 weeks. And then you have a fibrosing stage. This again can initiate within a couple of weeks of the injury and can last even up to 4 weeks post-injury. It looks something like this. Where you can see the degenerative phase and inflammation is very strong initially, then it starts to decrease as regeneration builds up, and then fibrosing starts to kick in as well. we're trying to maximize regeneration and minimize degeneration, inflammation, and fibrosing, right? So the beauty about laser therapy is it has a lot of tools, a lot of activity that can actually help you achieve this, which means more complete healing and faster resolution of a muscle strain. So obviously a muscle strain occurs when the force on a muscle is so great that the tissue actually begins to fatigue and tear. It usually occurs, well, it can occur in three places: within the muscle itself, or the muscle belly itself, at the junction between the muscle and tendon, so the muscle tendinous junction. That's the most common site, by the way. And then the tendon itself. A tendon tear is not a muscle tear, but it is part of a muscle, so you can kind of loop it in with that as well. So obviously during activities that require sort of explosive movements, pushing off during a sport, changing directions quickly, the force across the musculotendinous junction can be so great that in fact there's a tear that can occur. It can be partial tear or obviously a complete tear. Usually it's a partial tear. So these injuries occur commonly when there's this excessive loading, especially when the muscle is contracting while it's elongating. So muscles that cross two joints are the ones that are most commonly affected, like the hamstring muscles, or muscles that cross the knee and the ankle joints, like the gastrocnemius, for example, and the quads, very commonly injured, strained muscles. The hip adductors are also commonly strained, but they of course only cross one joint. So the factors that predispose to a muscle injury, obviously, the older you get, the greater tendency for these injuries to occur, poor flexibility, lack of strength, and fatigue. Oftentimes these injuries occur towards the end of a game or whatever activity, and the muscles are fatigued and you end up straining the muscle. So many athletes sustain these injuries when they start to begin their training regime. So like, in training camps, whether it's NFL or NHL, or maybe you're starting to train for an event or what have you, that's when you tend to see more of these muscle injuries, because the tissue is not used to doing these activities. So they can be categorized into three grades. Grade 1, obviously mild, not very much tissue damage, less than 5%, minimal loss of strength and motion, if any. Then grade 2, a lot more extensive issue of muscle fibers that are oftentimes completely ruptured. So there's significant loss of strength and motion. These ones tend to require several months to heal. They're quite serious, and if they're not properly healed, then the athlete or the person will oftentimes re-injure and not have a successful outcome. And then grade 3 is complete tear of the entire muscle belly and or the tendon. If the tendon's involved, surgery is required. If the belly's involved, I don't think they can do much surgery-wise. Personal experience, I completely ruptured my medial head of my gastrocs maybe 15, 20 years ago playing basketball. I landed on a guy's foot, and then my foot went into a very quick dorsiflexion, and I felt a really sharp pain. I thought it was my Achilles that ruptured, and I went and felt down by my gastroc, and I felt this big, sort of depression. I'm like, oh, this isn't very good. So I ended up going to the hospital, emerge. They did ultrasound. They said, oh yeah, I got complete rupture, blah, blah, blah. We'll do surgery. Came back the next day to do surgery. And then the surgeon looked at everything, looked at me and said, we can't do surgery on you. I don't know why you're here, because it's a muscle belly. We can't suture up muscle. So long story short, when you have complete muscle ruptures, not a lot you can do. You're supposed to bring the ends of the muscle bellies as close as possible and try and let it heal, like in a ballerina cast kind of deal. I did not do that because I was practicing it, and didn't want to take the time off. So now I don't have a medial head of my gastrocs. There you go. So key symptoms of muscle strain are sudden pain that obviously worsens upon contraction. Obviously, there's going to be edema, usually bruising, loss of strength and range of motion. And as I mentioned, usually you feel sharp pain, or the patient feels sharp pain. When the muscle is initially injured, there's usually the cardinal signs of inflammation. So after this inflammatory phase, the muscle starts to try to heal from those myosatellite cells. I said stem cells, but to be honest, they're not really stem cells because they're a specialized muscle cell. It's just like a baby muscle cell, you might say, but it's not a stem cell that can turn into anything kind of scenario. So there's usually a significant amount of scar tissue that forms where the muscle was damaged. And as I mentioned earlier, over time, the scar tissue remodels, and it's usually not completely fully regenerated, which means you're prone to re-injury. So return to activity is usually recommended when that patient is pain-free, range of motion is normal, and full strength. If the person doesn't abide by this, they're going to re-injure themselves. If an athlete attempts to return before these criteria, then it's just going to lead to a setback. So mild grade 1 injuries may require several weeks before they can return to the sport. And obviously, the more severe, the longer the time to return. As far as rehabbing these muscle strains, mechanical stimulation is considered to really be helpful for muscle regeneration. Stretch activation, mechanical conditioning, massage, physical manipulation of the injured muscle tissue have all shown to have physiological benefits. The problem is you can't always do these things right off the hop, which is why laser therapy can be done literally the day of the injury. And as you start to get healing, then you can oftentimes start to engage these types of mechanical stimulation. Early on, when you have an injury, what happens is you have neutrophils come in and then macrophages. The macrophages have two phenotypes, M1 and M2. M1 is the inflammatory macrophage. It comes in there, guns a-blazing, initiates inflammation, secretes pro-inflammatory mediators. And what you want is you want M1 phenotype to clean up the mess, hurry it up, and start shifting to its other phenotype, M2. M2 macrophages do the opposite. They actually are anti-inflammatory, secrete anti-inflammatory mediators, pro-angiogenesis, pro-wound healing, secrete these the positive anti-inflammatory mediators. And what's really interesting is that laser therapy is shown to increase the rate at which M1 turns into M2. So by doing that, you can speed up the process of healing. The other way it works is on the myosatellite cells. As I mentioned earlier, they stuck to the skeletal muscle fibers. Those are the green blobs you see, and they will actually be stimulated to help heal and even generate new skeletal muscle fibers. And we know that laser therapy actually increases their activity and the numbers of myosatellite cells. So that's another way that photobiomodulation can be helpful. Generally speaking, in an injury, oftentimes acute immobilization, is beneficial, but it can compromise skeletal muscle repair. So there's a fine line between having that person be completely immobilized and actually starting to try to engage the muscle tissue. So skeletal muscle loading exercises may increase the number of satellite cells, their proliferation, differentiating capacities, and enhance the repair process. It helps to reduce, it increases vascularization, collagen turnover, and therefore it should be promoted all through the different stages of muscle repair during the rehab processes. So the patient should be engaged in active eccentric exercises, so lengthening and contraction exercises during recovery will help injuries like the hamstring recover faster. Of course, you have to gauge when you can do these because it depends on the extent of the injury. This particular paper research I have here is called Skeletal Muscle Loading Changes its Regenerative Capacity. And the other thing they notice is that using heat after the acute phase can also accelerate proliferation and differentiation of myosatellite cells. And one has to remember that while there's acute benefits of rice, You have to also understand that it may prolonged rest may actually impair skeletal muscle regeneration. So, there's a fine line between saying don't do anything to start to do exercises. So that's really important to understand. PRP, or platelet-rich plasma, is now being used routinely, especially for athletes. For those of you who are not quite aware of that, it's basically homologous blood. It's drawn out of your body, spin it down, different cycles, take out, extract the platelet-rich serum, and then inject it back into the injured area. This promotes growth factors, increase in growth factors, and other chemical mediators that supposedly help with healing. And the research, for the most part, indicates that's the case. So it's not quite sure how it works, but we're definitely seeing some good results with that. However, it is a violation, a doping violation, if you do PRP on athletes that are, Olympic caliber or in different amateur sports. So one has to be careful that can't be done. But of course, photobiomodulation is not a violation, and so one can do that. This paper looks at the analysis of using both PRP combined with laser therapy. And I won't do the whole paper, but essentially they found that PBM, or photobiomodulation, with PRP and the combination of these, so both, we're able to reduce oxidative stress caused by injury and modulate production of collagen in the tissue. And overall, it showed that there was better histological repair when the two were done together. So why do you want to choose photobiomodulation or add photobiomodulation? As I mentioned earlier, as a recap, it's going to help these satellite cells become more activated, more effective. It's going to increase the positive growth factors and improve microcirculation, amongst other mechanisms I described earlier. So it all works on a cellular basis, very different than the mechanical effects that one might do for, that you're used to doing on these patients. Okay, so how are you going to use laser therapy? What you need to understand is where the muscle injury is, the depth, right? So if you look at, this is a cross-section coronal plane of the gluteal region, right? And you cut through there, you see the gluteus max, and you'll see deeper muscles. So let's say it's a mid-level gluteus maximus muscle strain, then you need to visualize the depth that that tear is from the surface of the skin. So that might be 1 centimeter, 2 centimeters, 3 centimeters. That's important to know. Now, what if the tear is in a deep muscle, like the gluteus minimus, or even the medius that lies deep to the gluteus maximus? Well, now you have a much greater distance. So when you're using photobiomodulation, you're going to increase your time of treatment to allow more light to get to the greater depth, as well as perhaps increasing power. And also, if you have equipment like BioFlex, you can actually push the tissue inwards or depress it to allow the light to get closer to your target as well. Because remember, light can only go so deep, and sometimes it can actually go as deep as you want to treat some of these muscle injuries, depending where they are. So deeper, larger muscles require longer treatment times. For best results, you want to initiate laser therapy as quickly as possible, certainly within 24 to 48 hours of injury. So if you work with athletes or patients that do sports, I would definitely always tell them, hey, look, if you ever pull a muscle, have an injury, get in here right away, even though I'm a massage therapist and I can't actually get in there and manipulate the tissue. You may think, oh, I'll give it a few days before I go in to see the massage therapist or chiropractor or physiotherapist. That's not what you want to do with laser therapy. You want to initiate it as soon as possible. Remember, push the laser probe into the tissue being treated within the patient's tolerance, obviously. Again, it allows the light, the source of the light, to get closer to the target tissue. The dual arrays of LEDs that we use, apply them as well and use weights to depress them and gently push them into the tissue as well. You'll want to customize your protocols to treat adjacent muscle tissue as well as the actual injured site. The idea there is to reduce hematoma and also promote a systemic effect. You can progress and increase frequency and duty cycle fairly aggressively with muscle injuries. And as I mentioned earlier, you'll want to initiate skeletal muscle loading exercises, eventually heat and manual therapy as soon as possible. So here's an example. I don't know if you can see it or not, but on the mid sort of area, maybe slightly mid distal area of the hamstring is a tear in the biceps femoris muscle. So what you're going to do is you're going to do your first placement over that target area. Okay, so let's say the depth is relatively, it's a thick, relatively bulky muscle. So you want the light to get in there fairly deep. So I'm going to suggest you start with about 6 minutes of red. Now that's not going very deep. That's promoting more the superficial structures, some of the superficial muscle tissue as well. And then go into infrared. And infrared is going to go much deeper. I'm going to suggest you maybe use 8, 9, or 10 minutes of time. Again, longer time because of big, thick muscle tissue that you're working with. And a good sort of frequency and duty cycle would be 50 hertz or cycles per second, and anywhere between 50 to 70% duty cycle. Remember, duty cycle controls the energy or the total number of joules. So the higher the duty cycle, the more energy coming out of your equipment. Then you're going to do other placements based on the hematoma that's forming. So usually proximal and distal. And for those areas, you're not treating as deep as possible. You're treating more the pooling of blood and the bruising. So for that, you can reduce the treatment time to 6 minutes of red, continuous wave, and 6 minutes of infrared at a lower duty cycle. You don't need as much energy, so maybe 30 or 40%. Okay, so just a recap, you might have certainly going to have one placement and probably 1 or 2 placements for, say, a hamstring tear. The first one focusing on the deep muscle tissue, and the proximal and or distal placements depending on where the hematoma is. So you might have another 1 or 2 placements with less energy. If you have a dual port, one of our new systems, you can actually use 2 arrays at the same time, and therefore the overall treatment time, including the probe, might be around just over 20 minutes or so, 24 minutes or what have you. So really efficient. You get that patient in and out within half an hour quite easily. A few other tips: make sure the skin is free of creams. Sometimes people use BioFreeze or different menthol creams, that kind of thing. They gum up the equipment, they can absorb light. Always make sure the skin is free of any lotions. And they can also affect the absorption of light, interact with the light. If the muscle strain is acute, then you can throw on a cold pack for 10 to 15 minutes before your laser therapy. This reduces the local circulation, local blood flow, allows more light to actually penetrate, to get deeper into the tissue. And so you can improve the depth of penetration as well. So always determine the depth and extent of the muscle injury that you're dealing with to visualize how deep you need to go. Therefore, you might hold the laser probe for 5 or 6 seconds or 15 or 20 seconds per point, depending on how deep. The deeper your target, the longer you're going to hold that laser probe in place. If you have the red laser probe, it's very helpful for pain, not so much for healing. in muscle tissue, but it can help reduce pain. So I would recommend that you also use the LDR 100. If you don't have that one and you're kind of wondering why you would want to get it, or should I get it, or blah, blah, blah. I mean, end of the day, it's another tool to have. It's quite effective for analgesia purposes. The reason how it works is that the light is very intense in a very small superficial area where there's lots of nociceptors. And so those nociceptors can be temporarily inhibited and cause some pain relief. At the same token, it is also helpful for anything superficial that you're treating as well. Then you would follow up with the LDI 200 laser probe. Again, the total treatment time for the laser probe might be a couple minutes, it might be 6, 7, 8 minutes, or even up to 10 minutes, depending on the extent of the tissue damage, right? So typically it's going to probably, for a hamstring, I'm going to say 4 to 6 minutes should cover that. Treatment plan, you're going to treat an acute muscle strain at least 2, 3, maybe 4 days in a row, then treat every other day, so 2 or 3 times a week. And then as you're seeing really good progress, usually within a week or two, you can start to reduce the frequency to twice a week and then once a week. In general, if you use laser therapy, you're going to see at least 30 to 50% faster healing. And oftentimes it's even better than that compared to standard care. So the goal really is not just to heal the tissue, but to allow for complete healing with less or minimal scar tissue, all right? If you do that, if you do laser therapy from the very beginning, you will actually help reduce the overall amount of immature scar tissue that's left after the injury. Your patient needs to be well educated with respect to home exercises, home care, have a reasonable expectation when they can return to their activity, and be firm with them. And if they choose not to listen to your advice and they complain about that they got re-injured, then you can just show them a mirror and that's who's to blame. Okay, so maybe not the best patient management advice, but upcoming events. Next webinar is a lot of people are talking about these LED panels like Juve, and there's a whole bunch out there, and how they would compare with BioFlex. Do they have any value? You know, that kind of scenario. They're all over, you know, different social media. Some of the facts are accurate, most are not. So I'll kind of give you a wrap up on that. And then I have a webinar coming up specifically for massage therapists, massage therapists that maybe don't use laser therapy, that are interested in understanding why that might be beneficial for their practice. And then if you're a healthcare professional that doesn't actually use BioFlex and you're a little bit more interested in laser therapy, then I would invite you for one of our Light Up Your Practice 3-hour seminars. Next one coming up is August the 6th on a Saturday, 9 a.m. to 12 p.m. There's a nominal fee involved. So if you have a chance to check that out, I do that live on August the 6th. Okay, so good timing today. I finished right on time. Let's see if you have some questions here. If using the LDR, should we first do the arrays, then the red laser probe, then infrared laser probe after the red? Yes, so if you have the red laser probe, generally speaking, you're always going to do the arrays, the dual arrays of LEDs. And then if you have the red probe, do the red probe and then the infrared probe. Oh, I see, I answered that. Okay. And a question about pain treatment, would using the red probe without arrays or infrared probe also be helpful for pain? Yeah, and in fact, actually the red light in general is really good for pain control. So the red from the LEDs will also be helpful. But when you have really intense light from a laser, it's more effective for pain control. A question here, I have a 20+ scar 20+-year-old scar tissue knots that my physiotherapist is using his elbows heavily on. Can your system break down the scar tissue with 5 years of damage? Okay, so you can actually reduce chronic scar tissue to some degree. I've seen up to 20–30% reduction, maybe a little bit more. So you can, but it takes quite a while for that to happen. But I guess to answer your question is yes, you can reduce some of that chronic scar tissue that's built up. Okay, so I'm not seeing any other answers here, I don't think. See here. Just looking. Would you recommend laser therapy for bruising on the leg after surgery? I have the P180. Yeah, it's very helpful for that. Absolutely, Michelle. If you wanted to email me, you can do so, and I can kind of give you some guidance on that as well. Can it be used as preventative on a thumb strain for a reflexologist? Oh man, I feel sorry for reflexologists. I've had it only done once. I liked it, but it was painful. And I could see why your thumbs might have an issue. Yeah, in fact, if you were to pre-treat your thumbs, I would treat them every day or every other day. You're going to help with reducing potential arthritis and also just keeping the general health of the tissues. But end of the day, if you do that every day, you're still going to have problems, unfortunately. Oh, okay. Yeah, maybe it wasn't, maybe, you know what? Yeah, maybe that a treatment I had was a little too aggressive. so I should probably try it again. But it did feel good, but it was just too painful. Maybe I'm just a wimp, I don't know. Do you want to ask about, I have some clinician, sorry, I wanted to ask about some clinicians that use cling wrap over the head of a laser diode. Can we use that because of COVID? I'm not sure I understand that question, Rashimi. I don't know why you'd use transparent wrap over the head. We use transparent wrap over like a wound, open wound, for any infection, that kind of thing. I'm not sure how that relates to COVID, however. Okay, let me see, might be a couple more questions here. How does it help with concussion? Oh, okay, well, that's a huge topic. So it helps with concussion mostly systemically or remotely because light can't really get too much into the brain. So it has an effect on circulating stem cells and white blood cells that shift the immunomodulating state, you might say, of these cells to a anti-inflammatory state. And when they circulate, eventually they circulate to the brain, they're attracted to areas of injury or disease, in this case, concussion, and it can help propagate the healing. There's tons of research out there. I'm not sure who's asking that question, but you can email me. I can send you some of the research and mechanisms behind that as well. Same thing for headaches. You know, headaches from concussion, there's usually a cervicogenic component. So, you know, treat the cervical spine. It could be actually cranial issues as well. But it is helpful for headaches as well. Vivian has said she's had PRP on her arthritic knees. Will laser decrease and assist with healing of pain? I think I covered that. Actually, I said that, in fact, combination of PRP and light therapy shows better overall effects than just PRP. So definitely, yes. All right, thanks for joining me, everyone. Have a fun summer and stay out of the heat, you know, blah, blah, blah. Don't get COVID for the 15th time, and we'll see you next time. Bye now.